Welcome, and thank you for taking the time today to sit back and watch this DVD. At the end of this program, it is hoped you will have a better understanding of the Department of Veteran Affairs and discover benefits that you may be eligible for. So sit back and enjoy this presentation. We're going to talk to you about the VBA, the Veterans Benefit Administration, the VHA, the Veterans Health Administration, and within that, voluntary services at the Veterans Healthcare Service of the Ozarks and pharmacy services, and as well as the NCA, the National Cemetery Administration. But before we get started, let's try and explain to you exactly the history of the VA, who we are, and the values as employees of the VA that we strive to achieve each and every day. The history of the VA and serving the veterans of America go back to the start of our great country. However, in more recent times, we have to remember that going back to 1921 is when Congress combined all World War I veteran programs and created the Veterans Bureau in 1921. In 1930, the Veterans Administration was established as a federal administration, and in 1959, the VA adopted the phrase, "to care for him who had borne the battle, and for his widow and his orphan." And of course, this was from President Lincoln's second inaugural address. That phrase is still inscribed on the VA headquarters building at 810 Vermont in Washington, D.C. still today. In 1989, the VA was established as a cabinet-level position, and in 2014, VA Secretary Robert A. McDonald and Deputy Secretary Sloan D. Gibson were sworn into office. The mission of the Veteran Affairs Department is to fulfill Lincoln's promise that he made to the country during his second inaugural address, to care for him who shall have borne the battle, and for his widow, and for his orphan. And we do this day in and day out by serving and honoring America's veterans and their families. The roadmap that we like to follow is to deliver on current commitments to the veterans. We want to increase access to care, which will in turn eliminate backlog and end veterans' homelessness. We want to make sure we innovate to improve the veteran experience, establish a VA-wide customer service organization that will design and implement a superior veteran experience and leverage strategic partnerships as a force multiplier. We want to make sure that we can empower our leaders and employees so that we can realign internal support services to improve efficiency, reduce cost, and increase productivity. We want to remove processes that impede good customer service while establishing a culture of continuous performance, improvement, and focus on people and culture to attract, retain, and develop high performers. Over 3.7 million veterans currently receive compensation benefits from the Veterans Benefit Administration, or the VBA. In 2015, the VA processed the highest number of disability compensation and pension claims in history, 1,320,870 claims. That's 67,000 more than in 2014. The VBA also delivered over $46 billion in 9/11 post-GI Bill education benefits to over 1.3 million veterans and eligible family members in 2014. The VBA also guaranteed a record 631,000 home loans and assisted 80,000 veterans in avoiding home foreclosure in 2014. The VBA is proud that 50% of their employees are veterans. Welcome, Lisa, and thank you for joining us here today.
Thank you, Tom.
We just heard some staggering numbers that the VBA administers yearly. And we constantly hear the VBA mentioned in conversations across America. But what exactly is the VBA?
Well, Tom, the VBA is the Veterans Benefits Administration, and we provide disability benefits to service members, veterans, and even family members. We've currently gone through a huge transformation that is people-centric, results-driven, and forward-looking. But the primary goal is to create a lifelong relationship with service members as they become veterans. And basically, when you talk to veterans, what they're interested in at the VBA is disability benefits.
Now, how does that relate to the veterans locally here?
Well, Arkansas has nearly 250,000 veterans, and 45,000 of those are in receipt of compensation or pension disability benefits. That equates to nearly $67 million per month going out into the local economies in Arkansas, and those are tax-free benefits.
That's fantastic. But you also mentioned earlier that the VBA transformation, how has that impacted the office here in Little Rock?
It's been incredible, Tom. We have a new system where we have gone into a completely electronic system. We no longer deal with paper claims folders, and this has allowed us to become much more efficient and still maintain the high level of quality we always had with our veterans' benefits.
Now, you just mentioned the term claims. We hear every day on the news about backlogs, so how is the backlog scenario at the Little Rock Regional Claims Office?
In the past 3 years, the Little Rock Regional Office has been able to drastically reduce the claims backlog. We consider a backlog claim any case that takes over 125 days to complete. And we have reduced that backlog from over 5,600 claims in 2013 to 680 claims today. That's an 88% improvement. We're really proud that we completed over 16,000 disability claims last year, which was a record for the Little Rock Regional Office.
I mean, that number is just really amazing, especially the decline in claims that you now serve. But another change that is in progress that we hear about is the way veterans submit their claims. You know, now it seems that a majority of the veterans are submitting fully developed claims. What does that mean exactly, and how has that impacted our veterans?
That's right, Tom, and this is a great opportunity for our veterans, often working with their veteran service organizations, to complete claims that are ready to go the minute the VA receives them. The veteran will submit all evidence relevant to the claim so that the VA regional office doesn't have to do additional searching for evidence before being able to process the claim. Back in 2013, only 2.5% of cases came in as fully developed claims. Now nearly 50% of cases come in as fully developed claims. Average days to complete a fully developed claim is right around 100 days, as opposed to typically about 150 days if the claim is not fully developed. So we really encourage our veterans to submit fully developed claims if they need assistance with that, to go to the veteran service organizations, or to come into the VA regional office in Little Rock.
You know, all of this seems like a huge, just a massive undertaking. So if we were to generalize what type of benefits are available to our veterans, what would they be, Lisa?
Well, the main disability benefit that we hear about is called disability compensation. And that is for a disability that was incurred or aggravated by the veteran's service. It's a tax-free benefit, and in fiscal year 15, VBA nationally put out about $70 billion to 4.5 million veterans in disability compensation benefits.
Interesting. So if we really get down to it, they have to start somewhere.
Yes.
And everything starts, I'm assuming, with some type of applications or forms that they have to fill out. How would a veteran apply for benefits?
Well, we have one new system that we're really encouraging veterans to do is to use the e-benefit system online. And this is a great system for veterans to be able to go online, submit their claim, and also make changes to an existing claim, like if they have to add a dependent, for instance. We now have an automated system that we're working on that's working very well to submit those claims. If a veteran needs assistance in filing a claim, they can either get those applications online and bring them into the office, or they can just come into the office at Building 65 in Little Rock, and we'll be glad to help them. There are also county service officers throughout the state that are always happy to help our veterans.
So the county offices, both in Missouri, Oklahoma, as well as Arkansas, they can all take applications?
Absolutely, and they're happy to do so.
Great. And one other question. If you had one piece of advice for the veteran before they started their claim process, what would you recommend to them?
Definitely collect all of your evidence and submit that claim as a fully developed claim. That's the best way to go, the most efficient way to go, and the way to get your claim done with good quality and as efficiently as possible.
Wow. Thank you, Lisa, for joining us today.
Thanks
A wealth
for
of
having me.
information, and thank you. The National Cemetery Administration, or the NCA, is a proud part of the Department of Veteran Affairs, for it is the NCA that has the honor to say thank you to that veteran one last time on behalf of a grateful nation. The National Cemetery Administration has 4.2 veterans and their family members laid to rest at over 131 cemeteries around this country, and they maintain 3.4 million grave sites across America. For 5 consecutive years, the NCA has topped America's Consumer Satisfaction Index of customer satisfaction. And in the most recent survey year, the NCA has scored 96 out of 100. This is the highest mark for any organization in the history of the American Customer Satisfaction Index. The National Cemetery Administration conducted over 125,000 interments in 2015 and furnished over 350,000 headstones. The NCA is proud that 75% of its employees are veterans. Fayetteville National Cemetery is currently able to accommodate full casket remains and in-ground columbarium remains at this time. Fort Smith National Cemetery is able to accommodate full casket and in-ground cremated remains at this time. Now here's a short video to emphasize the commitment and dedication the NCA has toward America's truest heroes.
For all who visit, a national cemetery is an awe-inspiring experience. The final resting place for over 3 million American heroes. This is hallowed ground where we honor the service and sacrifice of our nation's veterans. The National Cemetery System began when Congress authorized President Lincoln to purchase cemetery grounds for casualties of the Civil War. Since then, veterans from every era and every conflict have been buried in more than 130 national cemeteries across the country. All honorably discharged veterans and their dependents are eligible for a burial at no cost to the veteran's family, as well as a burial flag, headstone or marker, and Presidential Memorial Certificate. With that burial comes a commitment to maintain every grave in every cemetery forever as a national shrine. To our veterans and their families, from a grateful nation, this is our sacred trust to you. Dan Murphy's son, Lieutenant Michael Murphy, was killed in action in June 2005. He was a Navy SEAL and the first recipient of the Medal of Honor in the war in Afghanistan.
We wanted Michael buried here because I knew Calverton. My parents are buried here, and I knew the people who operated it, and I knew the care and dedication that they put into it.
A vast majority of the employees here are veterans themselves. They served our country. And they look at it as serving, again, being able to help people at what may be the toughest time of their life.
It's not only a job, but it's a devotion, a way in which to honor those that have sacrificed in defense of this nation. And so I couldn't think of a more fitting place to put my son, a hero, in this cemetery.
Groundskeeper Bill McNaughton is an Army veteran and retired NYPD officer. Each day he visits the grave of his son James, also an NYPD officer, and an Army Reserve Staff Sergeant. James was killed in Iraq in 2005.
I think almost 30 active duty here from Afghanistan and Iraq. To me, all these guys, they're here with people who understand this sacrifice. They all understand. We all understand.
Edgar Marsaw served 19 years in the U.S. Army. He now works at historic Natchez National Cemetery in Mississippi.
Everybody here is like a family to me, and I believe in treating my family well, and everybody that's here, we want to make sure that when their loved ones come to visit them, we want them to be comfortable. We want, the overall appearance to be great.
My mom, my parents, my brother, my uncles are all buried in a national cemetery in St. Louis, and I remember how I was treated when I came there with my loved ones, and I try to do the same thing when families come into our cemetery, because we want them to feel that this is home and we're here to take care of them.
One frequent visitor is Albin Burtix, a veteran of the Korean War.
I visit my wife's gravesite traditionally once a week. It's close, easy access for me. It's peaceful, it's quiet. It's a great place to come for solitude and, of course, the memory of my wife.
Visitors to any national cemetery can't help but notice the special care taken of the markers and grounds, part of NCA's commitment to maintain them in perpetuity as national shrines.
It gives me great pleasure personally to know that when I pass on, that I will be interred here with my wife under these most beautiful conditions, without the necessity of family members having to come and to maintain the place or to discuss conditions with the management, knowing full well in my heart today that I will always be treated with dignity as having been a veteran, and that my wife has already had that same pleasure accorded to her. Love you and miss you, sweetie.
NCA understands that the death of a loved one can be one of the most difficult times in life. One way we try to help is by simplifying the process of arranging the funeral.
We make it generally very easy. There's no complicated forms, there's no waiting period, there's no complex eligibility criteria. If you have a copy of your discharge, that's all we need, and we take it from there in a matter of hours.
Furthering our commitment to veterans and their families, NCA has embarked on one of the largest expansion efforts in its storied history. The South Florida National Cemetery is one of 7 new cemeteries opening by 2009 to serve our nation's veterans.
Today we are doing our dedication program. There are over 400,000 veterans in this area that we will serve with this cemetery. My job as a director and the job of the staff is to provide an honorable and dignified burial for the family.
Today, Kim Reka has brought her children to visit the grave of their father, Christopher, a Vietnam veteran who was killed in the line of duty as a police officer in 2007.
There were about 5,000 people that came to the cemetery, and as my younger son Spencer referred to, it was a service that was fit for a king. He served his country and his community for most of his adult life. It was wonderful that he was honored, and the cemetery, they did a beautiful job. Everything just went so smoothly. It was beautiful.
I want to make sure that when they arrive here, everything goes according to plan. We treat each and every service as if it was the only one we ever did.
Burial services are provided for both casketed and cremated remains. Many cemeteries also provide interment above ground, in columbaria. Military honors are performed upon request by 2-person teams from the Department of Defense. Some cemeteries, like Minnesota's Fort Snelling National Cemetery, use volunteer rifle squads.
During our service, we first of all recognize the entrance of the deceased into the shelter. Right after that, we fire the rifles. Following that, taps, and then the folding of the flag, if it's necessary to fold the flag, and the presentation of the flag to the family.
And they place it in the hands of the widow, and you just kind of clutch it to yourself, because that's the symbol of what they did for this country.
50,940 funerals we have provided service for. Weather has never been a factor. We are out here every day of the week, and that's the way we work.
And they were older veterans themselves doing the shooting, and it was like they almost had a tear in their eye.
Well, yeah,
because they're honoring one of their own,
I say a prayer for all of them here, but it's so peaceful and so beautiful. When I pass, I'll be right here with Wally.
We take care of our own.
The National Cemetery Administration honors veterans with a final resting place that commemorates their service to our nation. All national cemeteries are maintained in perpetuity as national shrines. This service is provided at no cost to veterans and their dependents. For more information, visit our website at www.cem.va.gov. And thank you for your service.
Another benefit of the VA Healthcare Benefit Program is pharmacy and prescriptions. We're here today with Chris Albrecht, who's Director of the Pharmacy Program here at the Veterans Healthcare System of the Ozarks. Chris, hi, and welcome to the program.
All right, thank you.
Can you tell us a little bit about the prescription program here at the center?
Sure. So the VA Prescription Drug Benefit Program allows us to provide medications for our veterans. Those are usually written by our primary care providers, and we provide them here out of this VA in mail order. We try to do that within a drug budget that's set every year, and we try to make sure they're the most safe and effective medications we can provide for those veterans. Some of the veterans have service-connected disabilities that we provide with no copay associated with it, while some veterans don't have service-connected disabilities, and they may pay a small copay for those, $7 or $8. I know that there's a proposal right now that's going through that may change the copay structure, which appears may actually lower copays for a lot of our veterans. So we're excited about that.
That would be awesome. And how many prescriptions do you fill nationally and even locally?
We spend the VA in full filled 273 million 30-day prescriptions in 2015.
Could you repeat that number again?
273 million in 2015.
273 million prescriptions.
Our VA here filled 1.38 million prescriptions locally. So if you average that out per workday, we fill about 5,500 scripts per day, and 80 of those go to our mail-out facility. The other 1,100 are filled by the techs and the people you see at the pharmacy.
Wow, I mean, that sounds like an awful lot of prescriptions that we fill here. Do you have time for any other programs here that pharmacy takes care of?
Oh, there's so much that goes on behind the scenes. I would say the biggest thing, we have a huge clinical pharmacy program that has been developed here over the last 10 to 12 years. Pharmacists, unlike on the outside where they are working toward this, pharmacists here can actually treat patients for certain conditions. So they see patients for diabetes, anticoagulation, hepatitis C, high cholesterol, and they actually treat the patients for those conditions. We work real close with the University of Arkansas College of Pharmacy and take students from here. So there's about 55 students that come through here a year and do a rotation. They're going to graduate in their 4th year and become a doctor of pharmacy. Okay. We also started a pharmacy graduate year 1 residency where pharmacists who are done with school want to become a clinician and actually see patients for things. They do a year of residency and do that here. So we select 2 of those every year, and that's a huge deal for our VA.
Very active within the community and the pharmacy community as well. Tell me some ways that our veterans can get their prescriptions, because I know they just don't have to come here and show up right. And get their pills. What are other ways they can get their prescriptions?
Right. Well, you know, there's basically 4 ways that I tell veterans to get prescriptions. You can come in person. Not always the most cost-effective way. We can fill things locally, but as I said earlier, we do about 80% of our prescriptions mail out. So if they come to the window and they need something and they're out of it, we can provide it locally and then we try to mail it. The second way is when they get their prescriptions in the mail, they'll have a refill slip attached to that, and they can fill that out and send that in. They can also use a telephone number. If they look on their prescription bottle, there's a toll-free number that they can call to do a refill, and that's a good way to do it. That number changes occasionally, so try to use that. Or the best way the VA is really promoting right now is My Healthy Vet. It's an online service, and that's where they can register, get their medical information, all their prescription information, see how many refills. If they forgot something, they can see all of that and print it out. The cool thing we're doing with that now is the pharmacy's really driving one of the top questions we get is, where is my medicine? Has it been shipped? Where is it right now in the shipping process? And they can go on that and look and find their tracking number, and we're working hard to integrate that into My Healthy Vet, so it's a one-stop shop for the veterans.
We're definitely ahead of technology here, but one of the questions we constantly hear, complaints, is not from veterans, but just in mail order pharmacies in general, is it takes forever to get my prescriptions. What do you think the average time is from the time you get the prescription to the time you send it out the door?
Right. So if we send it to our mail out, if you order it today, it's anywhere from 5 to 10 days, depending on the weather condition, holidays, but that's generally for the post office. If there's something, if a veteran calls in and they need something emergently and urgently, if they have a proper address, we can usually get it there the next day to them.
Fantastic.
Yeah, and the good thing is we have with our C-Box, patients also often want medications, and we don't have a pharmacist at all our clinics. So what they can do is see a doctor at a clinic, and then we contract with outside pharmacies, non-VA pharmacies. Veterans can go there and get up to a 10-day supply of something they need, so they don't even have to wait for us to mail it to them.
So in the CBOC areas, and if there is a need, you have contracts in place with their local pharmacies to get them enough until they get the regular refill from us here at the VA.
For urgent emergent meds, which those change based on
every day.
Change all the time, but absolutely.
Now, how does choice, that wonderful word that's going around the VA now with our veterans, how does choice play into the pharmacy program?
Yeah, so choice is a whole new realm for VA. That's where patients go and see outside docs for one way or another. Our preferred way when a patient sees a non-VA provider, they're obviously, the provider they see is not in the VA system. So what we want them to do is bring that script to us, have the doctor fax it to us, and then what we can do is fill that for them using that non-VA physician. So they don't have to go and see their VA physician and have the go-between. They can bring it directly to us. But it's a great program and has really worked really well.
Chris, it sounds like you're way on top of things here, both technology-wise and customer service-wise, which is putting veterans first, which is what we're all about. What's the easiest way for somebody, if they have questions about pharmacy services, to get a hold of somebody to get those questions answered?
Sure. So the best way is, as I stated before in the prescription refill, if they look at their bottle, call the 1-800 number. There's options, and if you get a hold of a person, that person is in pharmacy, and if they need to talk to somebody else, they can be redirected to somebody in pharmacy.
Great. And how about somebody who has never used the service before? What's a good number for them, or a website or something of that nature? Yeah, there's
the VA web, va.gov, and they can go on there and find different locations of all VAs at that website. But va.gov, and then it gives them a choice to pick different areas. But I always recommend people stop in. They can ask anywhere. Almost anybody in this facility will help them out and point them in the right direction.
Oh, that's fantastic. Hey, thanks for spending some time with us today, and we appreciate all you do for all our veterans.
Thank you.
Thank you. Carol, welcome, and thank you for joining us here today. Many of us don't realize what an important part volunteering plays in the Department of Veteran Affairs. Could you fill us in a little bit on the hours and people that give so much to the Veterans of America here?
I would love to. Nationwide, we had over 75,000 volunteers who contributed over 11 million hours, which equates to 5,771 FTE, which is equivalent employees, which also equates to over $250 million in donations. Besides the hours that volunteers give, they also give gifts. We had over $105 million in that, for a grand total of over $356 million in volunteer hours and donations to our nation's veterans.
That is an amazing number, and I don't think anybody in the United States would understand the commitment and passion that equates to. That's unbelievable. Now, how about here in the Ozark region? How about our volunteers here?
Last year, in FY15, we had over 600 volunteers, and they donated over 47,000 hours. Now, when I say that, I'm talking about Fayetteville, Mount Vernon, Missouri, Branson, Missouri, Jay, Oklahoma, Fort Smith, Arkansas, and Ozarks, Arkansas. So over 47,000 hours. That equates to 25 employees. 25 employees that we did not have to employ. Our volunteers gave that kind of time. And they also gave over $1,235,000 total in resources.
What type of opportunities are there for volunteers both here at the main campus and out in the community, especially around the C-Box?
Well, we have escorts. We have greeters. Our greeters are very important. They're at the main lobbies, and they greet our veterans. If you were in Building 21 today for our event, you saw where they greeted the vet and said, where do you need to go? And they gave them the directions, or they even escorted them to that. We have one of my very favorite volunteer opportunities is the coffee service. We have veteran service organizations and donors who donate money for coffee, and then our volunteer assignment is to take the coffee, make it, and get it ready, and then go out and serve our veterans. And think about it. You're giving people coffee, you're getting to interact with them, and it's wonderful.
So the veterans take a coffee cart up and down the hallway
yes,
and
our
give
volunteers
veterans?
do.
That is amazing.
That is amazing.
That is fantastic.
Something else that's very important, our volunteers actually take vital signs for the nurses, vital signs of our veterans, and do it for the nurses. And that's boy, if I don't have a volunteer down there in that vital signs room, they're calling me saying, where's my volunteer? We have DAV drivers who drive veterans in for their appointments. And that sort of thing. And we have a number of administrative clerical positions. So we have something for everyone. Perhaps you would not be able to walk very much. Fine. We have a job where you could be sitting. Or if you would like to be walking and you need the exercise, we have plenty of those positions as well.
Oh, that is fantastic. And again, I don't think the people of the community have a clue with how many volunteer hours there are. What are some of the major events that you sponsor year-long here at the hospital?
You know, I always say I have the best job because I get to host all of our veterans and our guests and that sort of thing. Today we started with the National Salute to Veteran Patients. Traditionally, it's every year the week of Valentine's Day. And we invite the community to come in and meet and greet our vets. But the best part of it is that we have the school children to make the Valentines, and that's what our visitors distribute to the veterans. And it's just a wonderful opportunity. We have many we have many honor ceremonies. We traditionally do our POW MIA in September. We do our Military Order of the Purple Heart recognition in August. And of course, we do our Veterans Day celebration in November. I want you to know that every day is Veterans Day here at the Veterans Healthcare System of the Ozarks, but we do a special day for that. And I'd also like you to know that we have a very special event coming up, a new one, and that is on March 29th. We're going to kick off our 50th commemoration of the Vietnam War celebration, and so we will have a special honor ceremony that day. So we do that. We do our National Veterans Creative Arts Festival, which is a national therapeutics recreation event program, and we do a local competition here, and then our local winners get moved on up to the national level, and then in October traditionally there is a national festival at which they get to participate. We've had winners in the past to go. We have even hosted the festival here in 2011.
That's what I understand.
Yes.
The national event.
The national
event. For the
event.
whole country, for the whole Department of Veteran Affairs was here.
Was here.
And
we had a blast.
Oh, that's great.
Now, on the other side of it, the sporting aspect of it is the National Veterans Golden Age Games. We also hosted that national event in 2014. And that's an effort to get our vets 55 and older who are seen at a medical center. That's our effort to get them up off the sofa and exercising and exercising their mind as well as their bodies and competing. This year they'll be going to Detroit, Michigan in July to compete, and we call ours the Razor Vets, and it's just a wonderful, wonderful program.
And do you know how many veterans take part in those games?
Oh gosh, we had probably over 20,000 at our Golden Age Games.
Fantastic.
And for the Creative Arts Festival, which builds all year long, that one there, last year there were like about 3,500 veterans nationwide on that one. The Creative Arts Festival is the smallest of the national events.
And I can't go without asking, but this campus and this area is known for its Christmas bazaar that you all have for the
War
veterans.
Eagle Fair?
Yes, please tell us a little bit about
War
that.
Eagle Fair is held the third weekend of October out at beautiful War Eagle Mill, and thousands and thousands of visitors come to that. And actually our Bella Vista veterans, if I recall, do a lot of car parking and fundraisers up there connected with the crafts fair. But they bill themselves as the granddaddy of all, and it is truly an experience.
Oh, that's fantastic. If somebody wants to think about volunteering or want to talk to somebody about that, how should they get a hold of somebody?
Oh, that is so easy. All they have to do is call our office, 479-444-5060, or they can send me an email if they really want to, Carol, CAROL.Kick, K-I-C-K, @va.gov. It's simply a matter of obtaining the application, filling it out, turning it in, and then coming in for orientation. And it's very painless, and we just get you set up. We talk with you about what you would like to do. Like I said earlier, if you like a sitting job or a walking job or whatever it is you want to do, and we can get you going.
That's fantastic, and thank you for taking time out of your very busy day to visit with us today.
It's my favorite thing to talk about is my veterans and my volunteers.
Thank you.
Mm-hmm.
The Veteran Health Administration operates the nation's largest integrated healthcare system in America. It operates 150 medical centers and 1,400 outpatient clinics and serves 9 million veterans per year. Additionally, in 2014, 374,000 phone calls were answered on the VA crisis line. The Women's Veterans Call Center made 93,000 calls to women veterans to share information about VA services they may be eligible for. Many Americans don't realize that the VA's outpatient pharmacies has received the highest customer satisfaction scores across pharmacies in America. Veterans also give VA higher satisfaction scores than patients at private hospitals, and that the VA employees have won 3 Nobel Prizes and 7 Lasker Awards. Additionally, the VA has created the nicotine patch, did the first liver transplant, and trains 120,000 healthcare professionals a year. An estimated almost 70% of all the doctors in America have trained with the VA. The Veterans Health Administration in 2015 completed 7 million more appointments than in 2014, and the average wait times have come down drastically. For primary care, the average wait time is 4 days. For specialty care, the average wait time is 5 days. And for mental health, the average wait time is 3 days. And additionally, the VHA has increased their staff nationwide by 14,000. You know, Brian, I didn't realize that there were so many facilities in our area to serve our veterans, but I also understand that the people of this area should be very proud of the awards and honors that the Veterans Healthcare System of the Ozarks has won. Can you tell us more about these prestigious awards?
Yes, the Veterans Healthcare System of the Ozarks is proud to announce that we have been honored for our high quality of health care, veteran satisfaction, and employee satisfaction over the years. Some of our recognitions include the Joint Commission accreditation. We're designated as a healthcare equality leader in the LGBT community. We have our CARF accreditation for mental health and social work programs, and we've been recognized by the Arkansas governor.
Wow.
And we also had the Robert Carey Award and the Robert Carey Award for Circle of Excellence. But most importantly, we're proud to have served our veterans every day, and that's really an award enough for us in the Veterans Healthcare Systems of the Ozarks.
You know, it's amazing that the VA healthcare system here in Northwest Arkansas that serves all the areas you mentioned is such a leader in healthcare and innovation. But let's get down to the basics and the specifics if we could. Let's start with enrollment and eligibility in the VA healthcare system. What do they have to do?
Well, your comprehensive VA benefits include all the necessary inpatient hospital care and outpatient services to promote, preserve, or restore your health. VHA medical facilities provide a wide range of services, including traditional hospital-based services such as surgery, critical care, mental health, orthopedics, pharmacy, radiology, and physical therapy. While all enrolled veterans enjoy access to VA's comprehensive medical benefits packages, certain benefits, for example dental care, may vary from individual to individual, depending on each veteran's unique eligibility status.
And how would you find out if you're eligible for enrollment in these programs?
Well, anybody can find out if they're eligible for VA services by applying online, by mail, by phone, or in person at any VA healthcare facility. The quickest way is to use the online option by going to www.va.gov/health and selecting Apply for Health Benefits under the Resources. Veterans should make sure that they have a copy of their DD-214 handy when they apply for enrollment.
Give the audience, if you would, what other type of requirements must be met to be eligible for VA health care?
Well, once you apply for enrollment, eligibility will be determined based on your specific eligibility information. If a veteran served in active duty service and was separated under any condition other than dishonorable, he or she may qualify for VA health care benefits. Current and former members of the Reserve or National Guard who were called to active duty by federal order and completed the full period for which they were ordered may also be eligible for VA health care benefits.
You know, you hear the term copay, so let's say I'm qualified. Do I have to pay a copay?
Some veterans may be required to pay a copay for treatment of their non-service connected conditions. While some veterans qualify for free health care based on certain eligibilities, most veterans will be required to complete a financial assessment at the time of enrollment to determine whether they are eligible for enrollment and for free health care services. If the veteran's gross household, including spouse and dependents if applicable, income exceeds the VA income limits, the veteran may be required to pay a copay for health care services.
So that is why the veteran may be asked to complete a financial assessment and income verification.
Yes, and while many veterans qualify for enrollment in cost-free health care services based on a compensable service-connected condition, other qualifying factors, certain veterans will be asked to complete a financial assessment at the time of enrollment to determine their eligibility for cost-free medical care, medications, and/or travel benefits. There is no longer an annual requirement to provide updated financial information. VA now uses information from the Internal Revenue Service and Social Security Administration to match income information. For more information, call VA's toll-free number at 1-877-222-VETS between 8 a.m. and 8 p.m. Eastern Time, Monday through Friday, or they can contact an enrollment coordinator at their nearest VA medical center.
Oh, absolutely, and we'll be sure to show those numbers again at the end of the program. But now let's talk a little bit. There are a lot of veterans who are covered under private insurance. Can those veterans also use their veterans health care benefits in addition to or supplement their private insurance coverage?
That's a good question, and yes, they can. We encourage them to do so. Providing health insurance information may reduce or eliminate copays. Veterans with health insurance may choose to use their private health insurance to supplement their VA benefits. Payments from private health insurance usually covers copay expenses for VA health care. Having private insurance does not affect eligibility for VA health care. Many veterans apply for cost-free health care services based on a service-connected condition or other qualifying factors. I would like to also make sure the viewing audience is aware that the VA does meet the requirements for the health care coverage under the Affordable Care Act.
Yes. You know, Brian, that seems pretty straightforward, but how do veterans know if they have a service-connected condition?
Well, a service-connected condition refers to an illness or injury that was incurred in or aggravated by military service and has a rating assigned by the Veterans Benefits Administration.
Okay, well, I mean, that seems pretty straightforward, and everything we've discussed this morning seems pretty simple, but let's say once you have covered enrollment, you know, medical care and emergency care and health care, what about dental care?
Veterans often have questions about whether or not they can get dental care at the VA. Federal law limits the dental benefits provided by the VA. But in general, a veteran will qualify for outpatient dental care through the VA if they receive money for a service-connected dental disability, or are rated at 100% service connected.
But you know, there's another question I constantly hear. In fact, I was at an American Legion Hall the other night, and they love the veteran healthcare system of the Ozarks, by the way. They think it's fantastic, and they love it, and they can't sing the praises enough. But they constantly want to know, why do they have to go through a nurse first before getting an appointment with the doctor?
Well, that's another good question. You know, the veteran's concern may be best handled in a manner other than by seeing the physician. Our veterans are in excellent hands with our highly qualified nursing staff. They are able to triage the calls to determine what actions need to be taken, refer the call to the expert who can best help their concern, resolve the issue over the phone, and in some cases without the veteran needing an appointment, and a host of other means to help veterans and make sure his or her needs are taken care of in a timely manner. The nurse and the provider, they work hand in hand, and with the provider being made aware of the veteran's needs and concerns without having to see the veteran.
You know, when you put it in those terms, it makes total sense for all patients to see the nurse first so they can be fully evaluated, especially on what medical condition they have, and then make the appropriate care decision based on that. So it makes total sense, and I'll be sure to know that next time I hear that at the American Legion Hall. But now let's switch gears a little bit and talk about the wonderful telehealth program offered by the VA. Can you let the viewers know what about this program and what it really is, and how may it benefit them or their loved one who is being cared for at the VA?
Well, the VA is now recognized as one of the world leaders in telehealth services. This allows veterans to receive care through video teleconferencing technology from sites that may be very distant from the veteran. For example, a veteran who receives surgery at the medical center may be able to do his or her follow-up appointments at the local community-based outpatient clinic through telehealth. Or if a veteran needs a specialty service not offered at the VA facility, telehealth can be used to provide the consultation without requiring the veteran to travel. The service really does ease the travel burden on veterans, and at the Veterans Healthcare System of the Ozarks, we have many telehealth options available.
One other very popular program that the VA has designed and promoted is My Health eVet. Could you also explain what that is and how it works?
Yes, My Health eVet is a free online personal health record available to veterans, their family members, and VA employees. With an upgraded account, veterans receive health care at our facility will be given new tools to help manage their health care online. If a patient registers on My Health eVet, they can refill prescriptions, record military and family health histories, record and track illnesses, accidents, and other events, record and track over-the-counter medications, immunizations, and tests. They can even record, track, and print important vital statistics. Explore healthy living centers that talks about disease and condition centers, and online medical libraries. And there's a host of self-assessment tools that they have access to. However, if they want to access more benefits, they can upgrade to a premium account, which will allow them to access VA notes, access appointment lists, past and future, view their VA lab test results, and even access selected military service information.
That's fantastic. And there's no charge for an upgrade, right?
No. In addition, they're able to send and receive online secure messages with primary care providers, medical and surgical specialty services, mental health providers, and many other clinics. We continue to expand secure messaging throughout our facility with the goal of providing access to clinical areas at our facility as soon as possible. To register, just access the website at www.myhealth.va.gov. Click on the green Register Today button on the right-hand side of the screen and complete all the fields marked with a red asterisk. To access the wonderful premium account we discussed, we simply ask that they check in at the desk during their next appointment and be assisted in upgrading their account.
This next subject is something that is getting a lot of press around the country, and I understand that the VA has a wide array of services that addresses the management of chronic pain in our nation's veterans. And can you describe that a little bit further?
Yes, and we know that many veterans are faced with chronic pain either as a result of their service-connected disability or other health conditions, and that, this impacts the quality of life to a great degree. With the coordination of the PAC teams, veterans are assessed for their needs and treatment plans. A treatment plan is developed to address their specific situation with regard to chronic pain. We offer numerous alternative treatments and services that are positively impacting the lives of veterans who face chronic pain on a daily basis.
But one last topic before we close, Brian. Choice is the term being used in many different ways. Could you please explain to our viewers what the Choice program is and how does it work?
Yeah, and that's an easy one. The Choice program is a mechanism for the VA to use and be able to pay for care in the community under 3 situations. One would be if we do not offer the service at our facility. 2, if we cannot provide the service within 30 days. Or 3, if the veteran lives more than 40 miles from the nearest site of care. Okay. If any of these conditions apply, we'll work and coordinate with the veteran to provide the care in the local community.
Wow. It seems like we've covered so much in such a short period of time. And I guarantee the audience out there that we'll have every number on the screen at the end of this program. But one last thing. If the veteran still has additional questions, after everything we've told them about today, where would you advise them to start, or is there a number to call?
Well, our toll-free number at the medical facility is 800-691-8387. We're happy to answer any questions veterans may have regarding our services.
Oh, that's fantastic. Brian, thank you for being here today.
Thank you.
I feel very confident that the veterans in southwest Missouri, northeast Oklahoma, and the great northwest area of Arkansas are in good hands with you being the new director. Welcome, and thank you for visiting with us today.
Thank you.
I want to thank you for taking the time today, for watching this DVD. I know it was a lot of information to explain to you, but hopefully there were benefits that you found today that you were not receiving, or there are a possibility of benefits that you'd like to take advantage of. The numbers will scroll on your screen here in just a minute, but most of all, we want to say, and always say, thank you, veterans, for your service to this great country.